Our top story, India has added nearly 79,000 fresh cases to its COVID tally in just 24 hours, setting a rather dubious world record. It's the highest single-day jump in COVID infections reported by any country since the beginning of the pandemic. In the last 24 hours, 948 deaths linked to the highly contagious disease have been registered, taking the total number of fatalities to 63,498 across India. Now, about 27 lakh people have recovered so far, so that's a very welcome number, and it's a very substantive number. But the recovery rate, which was higher, is now going down somewhat, given the surge that we are seeing once again in some states. It's now at about 77% as of this morning. So let's take a look at the all India situation right now and what the indicators are at the moment. So let's bring up that graphic. And this is the big concern. As you can see, the arrow pointing sharply upwards. Let's bring that up full screen for a moment. We are seeing upwards of 76,000 cases for the last few days. And as I mentioned, just under 79,000 cases today. So from the 25th of August to the 28th, 29th of August, in fact, what we are seeing is a sharp spike going up, and that's a big concern. Now, this is generated by several key states, primarily 10 of them. So let's now focus on individual states which are not doing particularly well. Maharashtra is recording a new high of over 16,000 cases. There's a spike in the positivity rate as well. Let's move to the next point on Maharashtra. And let's talk a little bit about this, because we'll be talking about this in a couple of important states. R, it says Maharashtra R. R stands for the rate of reproduction of the virus. And it needs to be under 1 for us to confidently say that we are defeating the virus. But if you see, the arrow is up, and we are at a certain stage it was 1.2. It's at about 1.06, and that number could in fact rise. This data calculated till the 28th. As of now, we've seen yet another rise in Maharashtra, so that our number again going up. It's certainly not beneath 1. Andhra Pradesh, there have been over 10,000 cases which have been reported in the past 3 days. Again, that's going up. There is a slight dip, however, in the infection rate in the last couple of days. Moving to Karnataka, a spike in daily cases means that it's been the 4th worst hit state. Again, new cases, the trend going up. And as you can see, the trend for R, or the rate of reproduction, also shows an increase. Delhi, a matter of concern, because Delhi was doing so well, it appeared, just after the 20th of August to the 25th of August. As you could see, it was going down. The number of cases dropped sharply on the 25th. But from the 25th onwards, a sharp spike in cases. In fact, the biggest spike in cases now being registered since July. The spike in daily cases after a dip earlier in the rate of infection. And again, the R factor over here, that shows a sharp spike. It's at nearly 1.3 in Delhi. It needs to be, as I mentioned, under 1 for us to have any substantive aim at trying to get the situation better. Let's move quickly on to Uttar Pradesh as well. Now, the numbers in Uttar Pradesh, again, from the 25th of August, the number of new cases being reported sharply up, above 5,100 odd cases being reported from the 25th, above 5,100 cases from the 25th, 26th, 27th, 28th onwards. So that's another state of concern, and a consistent rise in since from the 21st of August in the R rate. It was above 1.10 on the 27th of this month. It's come down somewhat, but it's not nearly enough. It needs to come below 1, as I mentioned. So what exactly does this all mean? Dr. Hemant Thakkar, consulting physician and cardiometabolic expert at Jaslok and Breach Candy Hospital in Mumbai, with us. Dr. Naresh Trehan, the chairman of Medanta, the Medicity, with us as well. And Dr. Niranjan Hiranandani, president of NAREDCO and ASSOCHAM, to talk about the business aspects of this, because we are trying so hard to actually open up business. Dr. Trehan, let me come to you first. it's not really the situation as it was about 10 days back. Do these numbers translate into a second spike, at least in 10 states?
You know, this was not totally unexpected. The fact that unlocking is taking place, as we unlock, people go out where they are in large numbers. In some cities and states, the traffic is back to 70, 80%. So you'll know that this spike had to happen. But so now the basic problem is that people are getting more and more careless, whether they are fed up or whether of being cooped in or whatever. But that's not what they should be doing. If you are not going to mask, if you are not going to do your distancing, you're going to see the consequences of it. Now, another new thing that we have noticed is that the younger people who feel less vulnerable, they go out and they've started gathering in larger groups and things like that, and they are infecting their parents. So they get infected, and some of them, or large number of them, are asymptomatic. They don't even know till the parents get it and the family is tested. Then when you realize the kids are the ones who brought it in. So I think that there is this message for today that is very important, that the younger people should be more responsible. They must mask, they must keep their distances and hand hygiene, of course. But unless we follow these rules, we are going to see it getting worse, because as you know, that whole thing of life and livelihood is always playing two sides, and we have to unlock, because you couldn't stay locked up forever. History is repeating itself here like it did in other countries, yes, like US, like Brazil. So like we need not really be careless and wait for the worst to happen. So today we must understand we are in trouble. We should be extra careful, including the young and the elderly, of course.
Sure. Let me go across to Dr. Hiranandani. Sir, there's going to be the metro in Delhi from the 7th of the month. Interstate travel, no restrictions. Obviously, it's critical to open the economy. We are in a desperate situation economically as well. People, their livelihoods, their futures. And yet we have this reality. In a situation like this, do you not believe that, unfortunately, Unlock 4.0 should be delayed? It should be postponed?
No, I don't agree with you at all. Vishnu, there is a very, very important need to unlock. What Dr. Trehan said was absolutely correct, that we need to take care about the whole situation, but that does not mean that we continue to lock down. We have barely been able to start the economy again, and transport and other aspects have also been taken care. But I think both Delhi and Mumbai, I'm not hearing anything about Mumbai suburban. I think Mumbai suburban also needs to open about quickly as possible. A lot of the ordinary people who were living far away, Vasai, Virar, Nalasopara, all these places, and traveled by train, and they can't afford to come by car and other places. They need to come back to work at some time. Many of them have been thrown out of jobs and they're not able to do their work. I mean, how long can we possibly hold this? But having taken the rider from whatever Dr. Trehan said, I'm fully with the 4.0. In fact, I think we needed to do it earlier than what we have done it. And we will have to take care of it. But negligence cannot be negligence. Negligence
Dr.
cannot
Hiranandani,
be.
how does one take care of it if we have 78, let's say 79,000 cases in 24 hours?
See, the rate of, ours is a large population. If that rate which was there is now down to 1.06 as far as Mumbai is concerned, I think we are at a good figure compared to whatever it is that we have talked about. A little more emphasis on that, and I think we would be at this position. Because anything locking up, anything more than what we have done or continuing the lock-in would be a disaster to this country. Okay. And the economic side of it is certainly hurting a lot. We have barely been able to start it. And I'm fully with Dr. Trehan to say you have to continue to open it out. But the discipline is certainly required to be improved as far as the people are concerned.
Okay.
Not only young people.
So just one moment. I just wanted to also bring in Dr. Thakkar over here as well. Are you firstly seeing a rise in the last 10 days in hospital admissions at Breach Candy, at Jaslok, hospitals that you're associated with?
So I'll be honest with you, we were quite optimistic around the end of the third week of the month. But the last 5 days have certainly put the pressure on us. We're again seeing an uptick. We're seeing a clamor for beds. What is, I don't want to frighten you, but what is worrying a few of us who are actively treating COVID patients is that we are seeing people coming in with more lung involvement than we did see before. So at the back of my mind, I'm only conjecturing, is the Malaysian strain, is there a mutation somewhere that we are going to get into the city? You know, Mumbai and Delhi were doing very well. I don't know whether it's a new strain or whether because we had a festival. I completely agree with Dr. Trehan that if we throw caution to the winds, think of livelihood, yes, but do not think of social gathering and festivals and places where you can just accumulate to sheerly throw away your boredom, because that is transmitting the virus. We are also seeing younger people. We're seeing people at 35 and 45 getting infected. They are also beginning to come to hospital. But the 50-55 who are coming to hospital are coming with quite a bit of lung involvement. So I'm not here to say you have to fly the plane, because you have to fly the livelihood and the economy, but you're getting a second headwind coming up. France has again started masking people. Australia and New Zealand have back corrected. You'll have to learn to live with COVID. And unless you learn to live with the mask, with the caution, if you want to go for a livelihood, you have to mask. You have to obey, you have to take caution. If you open the trains, you'll have no place in the hospital. But if you want to open, which I agree with Mr. Hiranandani, that the economy has to roll, people have to understand. Just like the patients are coming extra and people are getting fed up, the medical facilities and healthcare officials are also at their wits' end. If a second wave now comes because of sheer carelessness, whether it's the young ones who are bringing it home or whether people are just walking unmasked, I still drive the car and I see people without a mask.
NDTV.
The mask is worn on the chin. If that happens, the healthcare facilities are already at their wits' end. They are strained. Help us to help you is what I'm going to say. We cannot deal with a mutated virus, but we can deal with the oncoming onslaught by looking after the civic rules. That's my plea. Okay. I agree with both the other speakers, what they said.
Dr. Trehan, is there a mutation that you're worried about?
You know, we don't know really. This is all conjecture or guesswork, I would say. We are all worried, most definitely. But you know, one thing, as you were showing the data from around the country, the cities and states which got affected in the early stage have been generally showing a downward trend. Like you said, Delhi in the last few days has been a little worrying, but I can attribute that to basically opening up. You see, like Dr. Thakkar said, people are out there. I was out jogging this morning. People were just walking in groups without masks. I mean, and when you talk, people are taking down their masks to talk. That's when you need it the most. So I don't know what it will take to bring that discipline into our population, because it is a people's war. We can, as frontline workers, help. So when we are the ones who are actually, like Dr. Thakkar correctly said, there is a lot of fatigue in the healthcare workers. The frontline workers have been at it for the last almost 6 months now. And the load, so like right now, UP, Bihar are on the uprise. So we are getting a lot of patients because in some of the cities there are not enough facilities.
Sure.
So Delhi, Gurugram, Noida, they are being flooded from outside.
I think these are important
points. We will not have
points.
enough facilities left
Yeah.
if we don't take those steps
Yeah.
that are required.
And this
So
entire
what
business,
can we do?
Yeah.
Insisting, keep hammering at the people that they must take the 3 precautions.
No,
On the
absolutely.
other hand, we must have good enforcement also.
All right, one sec, Dr. Trehan.
Catch me.
I just, we've got Kiran Mazumdar-Shaw also with us, and she's in fact recovering from COVID herself. And I'd just like to go across to her. I'd like to thank the 3 of you very much for joining us this evening. And I think the message is that we don't have the luxury of fatigue in dealing with this COVID situation. It's our lives, our livelihoods, which is very much at stake. I spoke to Kiran Mazumdar-Shaw earlier on this evening. Here's what she told me. Well, joining us now, Kiran Mazumdar-Shaw, the Executive Chairperson of Biocon. Thank you, ma'am, very much for being with us. Firstly, ma'am, how are you feeling? Are you feeling better?
I think I've almost recovered. I feel fine. And I think, it's good that I, recovered with a very mild experience of the disease, because I want people to know that most people will actually get away with my kind of experience.
And ma'am, again, how bad was it for you? What were some of the symptoms? Can you just tell us if it's not too intrusive?
Sure. I mean, I just basically had mild flu-like symptoms for a few days. I experienced, quite a few days of sweats every 2 or 3 times a day for several days. Mm-hmm. But once I got over that, I knew I had sort of overcome the virus and I was on the road to recovery. So it's about 12 days since I basically was tested positive, and I feel absolutely fine right now. My energy levels are back. I've, of course, never had any problems of breathing or any kind of drop in oxygen saturation levels. And I could continue with a very normal kind of activity throughout this disease, maybe except for 2 or 3 days when I felt a little fatigued. But other than that, I didn't feel anything. And I must say that I feel that most people will actually go through with this kind of experience. So I want people not to panic if they test positive.
Right. Ma'am, that said, and that's wonderful to hear, today, in the last 24 hours, we've reported 78,761 new coronavirus cases. It's a sad record, it's a global sort of record. This being the case, do you believe that Unlock 4.0 should continue or should it be postponed?
Look, Vishnu, I think we have to put all these numbers in perspective. Certainly, I think the numbers that you talked about, which is a daily surge in numbers, is worrying. But at the same time, you must also understand that now between 65 to 70% of people are recovering. I think we are fixated on the growing top line, which is 3.5 million. But remember, of the 3.5 million, 2 million have already recovered. And I think what we need to do is to keep tracking the daily additions in terms of how many people actually make it, find their way to the ICU. I think that is what we need to focus on. I would imagine that if we can bring those numbers to less than 1%, I think we will feel in a much better shape and state of mind than if we keep focusing on just numbers. Because I can tell you that of this 78,000 that you talked about, most of these people will actually go through with the experience that I went through.
Yeah. Ma'am, I take your point about the dangers of looking only at the top line numbers. But there are some other numbers which seem to indicate that at least in 10 states, we could be seeing the beginnings of a second spike, as it were. The R rate, the rate of reproduction of the virus, has gone up.
Yes.
It's at about 2. It was 1.06 earlier on. The positivity rate has also gone up. And therefore, is that a real concern now? Just when we felt that we were starting the process of sorting things out, it's back.
Well, certainly, Vishnu, I totally agree that we ought to keep the R0 number below 1, which is really the sort of the desirable level to be at. As I also said, we should try and keep the severe cases or the critical cases or the mortality cases definitely below 1%. That would give us a lot more comfort. But I also believe, Vishnu, that if people present themselves early, you will be able to reduce mortality. Now, the point is you've already lifted the lockdown for many months now. And yes, there is likely to be a spread of the disease, because unless you start strictly enforcing certain protocols like wearing of masks and physical distancing, I don't think you can prevent this spread. And unfortunately, many parts of our country are not doing a good job of this. For instance, you know that a place like Goa has managed to enforce it very well, and they have very low numbers. And some parts of the country who have been able to enforce these protocols have done much better than others. And I think it's really up to state governments. I am very concerned that many state governments have just thrown up their hands and said it's not possible. Believe me, this has to be a civil society movement. Goa is successful because the people of Goa have made sure that they follow these strict protocols. But if you think that only a government mandate is going to get everybody to follow these practices, I think we have to think again. Every one of us has to be very conscious about following these protocols. And therefore, I think you need to get civil society involved in enforcing these kind of measures.
The other key statistic or number in this is testing per million. It's very good that finally we've got our numbers up. But testing per million in India is still at 33,000. That remains the second lowest in the top 10. For us to be able to defeat this virus means we need to confront the real truth. Do you believe that a lot more needs to be done in getting hold of the real numbers? And by that I mean RT-PCR tests and not just rapid antigen tests.
I think you need a combination of tests, Vishnu, because by this stage you've got a population that's been infected in many ways. High viral loads definitely will test positive on rapid antigen tests. People who have actually been silent, asymptomatic, COVID patients who have recovered will also have antibodies to be measured. So I think you need a good algorithm to say, where are you going to do RT-PCR? And by the way, in RT-PCR, pool testing is going to expand RT-PCR capacity. And I think you need to have a combination of all these and work out models that really give you an idea about what's happening in every society or community.
Yeah. At this stage, we are opening up our boundaries between different states in our country. No restrictions on interstate travel. Metros will be restarted on the 7th of September onwards. I understand that it's impossible for people just to be at home, not work. People need to commute, people need to work because things are getting desperate. But isn't this exactly what we should perhaps not be doing now? Perhaps postpone it, given the numbers we've seen in the last 10 days. Again, an upsurge of sorts in at least 10 major states.
So Vishnu, the question I think we need to ask ourselves is, if not now, then how long are you going to keep it locked down? You see, that's the problem. We really don't have an idea as to how long any lockdown is serving any kind of purpose of preventing the spread. So you've seen that, lockdown 1 had a great effect. We had very few cases. Everything was seemingly under control. But the moment we lifted the lockdown, things went bad. Again, you had a case of the second lockdown where some people felt that, okay, things were under control, but the moment you lifted that, again, it surged. So I, for one, believe that you just have to accept the fact that numbers are going to surge. You need to really, really see how you can basically, enforce mask wearing. I really believe that mask, of course, you must take certain measures like not opening up, movie halls, maybe large gatherings should be avoided for some time. Well, yes, you're right. I mean, metro and things are public transport. So for how long are you not going to be able to travel is the question. So I think mask wearing has to be enforced. You have to do some physical distancing. And I think people have to be vigilant.
Sure.
I mean, if I am not vigilant as a person, and if I don't care, then, everything is not going to be able to be contained. But I think all of us need to understand that every one of us owes it to ourselves and to civil and to society to stop the spread. So I keep emphasizing this, saying that unless we all get involved, don't expect the government to just sort of mandate something.
Well, ma'am, it's wonderful to see you better, and I hope you're up and about completely in the next couple of days. And thank you very much for sharing your views. Thank you very much indeed.
Thanks, Vishnu. You too stay safe.
Yes, thanks.